Obesity is a problem that continues to get worse, not only here at home, but across the globe. The latest numbers from the Centers for Disease Control and Prevention are alarming. Take a look at this. In 2017 through 2018, over 42% of American adults were considered obese. That's an increase of over 10% from 1999. The estimated cost of obesity in the United States was 147 billion in 2008. And that year, obese people paid $1,400 more in medical costs than average weight people. So today we are joined by a very special expert, Dr. Meredith Duke, an assistant professor in the Division of General Surgery at Vanderbilt University. Welcome, Dr. Duke.
Thank you so much for having me.
Thanks for being here, especially to talk about something that is so important. So, Dr. Duke, let me start with something that I've heard many, many times, and maybe you can explain this. Obesity isn't a pandemic. It's usually been called an epidemic. So, what is the difference and why is it referred that way?
So an epidemic is a disease that's rapidly increasing in prevalence or incidence. And so obesity falls into the epidemic category in that the percentage of our population that was obese has increased at exponential rates over the last 50 years.
And what would you say is the difference then between obesity and then just simply being overweight?
So we use a metric called the BMI to determine somebody's healthfulness in regards to weight. So the BMI is the body mass index, and it's a measurement of weight in kilograms divided by height in square meters. And so a normal BMI ranges from 18 to 25. The overweight category is 25 to 30. And then class 1 obesity is 30 to 35. Class 2 obesity is 35 to 40. And class 3 obesity is the BMI greater than 40.
And when the term obesity is used, doctors refer to it as a disease, not just like a lifestyle issue. Why is that?
So that's a great question. There's a lot of stigma around obesity. There's this misconception that is a choice or lack of self-control that leads to obesity. And it is a chronic disease. It's multifactorial, much of which is genetic, heritable traits, how you respond to overfeeding, underfeeding, metabolism, so many other things that are not easily controlled by a simple equation of calories in minus calories out.
So would it be correct to say that maybe race or ethnicity plays a role here, doctor, whether one is born obese in terms of just developing that in their life?
Absolutely. Obesity is certainly increased in different populations. Our non-Hispanic Black population has one of the highest prevalences of obesity. And this is definitely associated, again, with heritable factors that contribute to this.
And what about income and education? Does that play a role as well? Because obviously there's a lot of factors here.
The incidence of obesity is much higher in our lower socioeconomic statuses. That can be lack of access to affordable, healthy food options, under housing, multiple different factors, as well as lower levels of education that are associated with obesity.
Speaking of questions, I have a viewer question here from Ross, and let's take that and see what he has to say. I remember growing up that when someone was overweight or obese, people would say that person has the fat gene. Is there really a fat gene? Doctor, what are your thoughts on this one?
There is no one single fat gene, if you will. It is, again, multifactorial, and we've identified greater than 500 adiposity-related trait genetic loci. It's definitely genetic, but it's not a singular gene that we can control.
Okay, but when one refers to that, because I've heard it as well in the past, and I personally don't like the way they say fat gene, but again, if a mom and dad are obese, does that guarantee that the children will be also because of just the genetic disposition?
So we do find that obesity, as well as the obesity-related comorbidities, do run in families. And so a family history of obesity, diabetes, hypertension, cardiovascular disease, all of those can run in families. So yes, having parents that are obese can predict obesity of their offspring.
I'm really glad Ross asked that question, and I really appreciate it, Ross, because I find that I have a friend of mine who has two parents that are obese, and she spent most of her life, doctor, if not all of her life, always trying to take care of herself because she always felt that she was going to have that predisposition. So is that something that one can do when they're younger to say, okay, I know I have to be healthy. I know I have to do exercise. I know it's all about lifestyle, but because my two parents were obese, I really need to make I guess, more of an effort, if you will.
So yeah, absolutely. Childhood obesity is definitely a predictor of adulthood obesity. And so this is one of the focuses of management of obesity, is trying to have early interventions to avoid the chronic nature of obesity as well as the comorbidities. And so instilling a healthy lifestyle, diet, all of those things are important to prevent obesity.
And I'm glad you brought up childhood obesity because this is really important. Let's take a look.
Again, inhale. Exhale. One more time. Inhale. Okay, we're ready to start our day.
My name is Claudia Mendoza, and for the past 5 years, I've been working with preschoolers. Child obesity it's a problem in the U.S. and it's a growing epidemic. But what worries me the most is something that could be prevented. 1/3 of kids are overweight or obese. But now as the kids come, I want to do something about it. They're like little sponges that absorb everything. So as much information we could pass them out to them, they learn and they talk about it and they take that to their families as well.
Amelia talks to me about the yoga classes, and she tries to teach me her yoga poses.
I saw the yoga class and it's like, I want to bring that to my classroom too. It's not the yoga that is like concentration. It's yoga for preschool, which is only focused on the stretching. And I also read that the benefits, is about controlling their bodies.
It was nice to kind of boost her ego a little bit with something that she could teach us that we really couldn't teach her at all.
We're gonna leave it in our garden so we could see how they grow and we could eat all the stuff.
Gardening and cooking with the kids is something very fun. And it also teach the kids, where the food comes from. It teach the kids, about the importance of nutrition.
Here she's planting a carrot, but at home she's taking care of a tomato plant. One of Miss Claudia's lessons.
If I could share an example of one of the kids, the parents shared with me that, at home he used to drink soda. So now he said, no, I need water because my teacher say I need to drink water. So the family started drinking water as well. He's making an impact as young as 4 years old.
Who's ready for lunch?
They're learning healthier habits at this age. It will stay with them for life.
When we go to the store, she'll pick out fruit that she wants, healthy alternatives.
Top fries. Campy cabbage fries.
I've seen my kid grown, not only academically, but as a person, as a human being, and she's really learning, things that will grow with her, that will make her make better decisions.
I sometimes wonder what is going on. The numbers are staggering. More and more children are overweight. Is it the social media? Is it the lack of exercise? Is it all of the above? Because as a kid, I remember we were always outside playing and doing things. And now kids are just on their phones and Instagram and, well, doctor.
So it's definitely concerning that we have so much more of a sedentary lifestyle, which certainly contributes to weight and having obesity. But it's not just that simple that we are sitting down more and so we are more obese in society. There definitely have been some changes to our diet, the way that we process foods, the hormones that are within foods, and so much research is happening to try and determine what is related to diet, what is related to exercise, what is related to metabolism and neuroendocrine responses to your diet.